Hi everyone, my name is Dr. Dan and thank you so much for joining me today. On today's video, we're going to talk about corneal ulcers or a scratched eyeball. I'm going to go over three things. One, what I look for at home from you, the pet owner. Number two, how I diagnose a scratched eyeball. And number three, how I treat it. And if my videos regarding pet health have been helpful for you, please like and subscribe. Of course, you have to go see your veterinarian to get it diagnosed and treated, but hopefully today I can give you a little more confidence. Most owners know their dog or cat scratched their eye. Maybe they're playing too hard with each other. Maybe you have a hunting dog that goes outside and runs through the brush, and we scratch your eye that way. But most of them come in and go,
Dr. Dan, a couple days ago, we just started squinting, and I'm pretty sure we were chasing something outside.
That takes me to my first point. When a doggy or kitty starts to squint a little bit, that's one of my first telltale signs that something's wrong. A cat or a dog should be, bright-eyed and bushy-tailed. They should have their eyes open, looking around, playing with you, and being happy. When they start to squint, I'm nervous they may have scratched their eye. Other things come along with that, because when they scratch their eye, it hurts, so they squint. You can get an infection too, so you may see some discharge forming. So if you were to open up the eye and look at it when they're squinting, you may not see much. You may see a really beet red eye, or you may see some cloudiness. But sometimes, if the scratch is really superficial, you probably won't even see it. Now, when your cat or dog gets a scratch in their eye, the scratch affects the cornea, which is the clear part, which is the part of the eye for me and you that we put like a contact lens on to see better. The cornea, when it gets scratched, there's a little bit of cells, and when you rub those cells off, or if you cut into them, it really hurts. And that's why they're squinting. It can get infected. It can get inflamed. That's why you see discharge. So, number one, most owners will say,
Dr. Dan, we're squinting, there's discharge, it's really, really goopy, we're pawing at it because it hurts a lot, and you know what? It just happened overnight.
I diagnose these with fluorescein stain. I take a little bit of that yellow stain and I numb the eye and then I drop that stain in there. The damaged cornea, it soaks it in, and if you shine a blue light on it, it glows beautifully. And when it glows, what we couldn't see before now becomes really obvious. And usually I'll show my clients and they're like,
Wow, Dan, it's right there. I couldn't even see it before.
You found the problem, you feel better, and the good news is scratches on the eye heal super quick. Once you start starting your eye drop, the corneal epithelium, the cells on the surface of the cornea, just grow across really quickly. It's amazing. And when they grow across it and they seal over, the pain goes away, any chance of infection resolved, and your doggy opens that eye up and we feel way better. The cornea actually can heal within a few days, and most owners are like,
Wow, you're a miracle worker, Dan.
That's why the eye's amazing, because it heals really quickly, but it gets bad really quickly too. So when an owner calls and says they have a squinting eye, I tell them, get in soon, because it gets bad in a hurry. How I treat these. The eye is going to heal itself quite nicely, but you need an antibiotic. You need something on the eye. You need to put those eye drops in there to keep the eye healthy while it heals. By putting an eye drop in there, you're helping to prevent infection. And your veterinarian may also give something for inflammation and pain. They may do a handful of things. But that's why you got to see your veterinarian to figure out what's going on. And if it's not healing quickly, you may have a problem on your hands. And you need to go back into your veterinarian quickly. I tell all my clients, we get better quickly and we get worse quickly. So if we're getting worse quickly, I want to see you again. Most corneal ulcers or eye scratches can be fixed in the veterinary clinic. I have had a few, unfortunately, that got really bad, or they were really bad when they came in and they needed an eye doctor. Yep, that's right. And right now you're thinking,
Wow, Dan, I had no idea that there's eye doctors for vets?
in rare cases, your veterinarian may refer you to an eye doctor just to make sure things are okay or to get things surgically corrected. Either way, if your vet says go, you should definitely go. I hope this was really helpful, guys, with regards to eye scratches, which cause corneal ulcers. I gave you my 3 tips about what you see at home how I diagnose it, and how I treat it. Please leave comments about what you've experienced and things that can be helpful.